A very good afternoon to one and all present here. So today our lecture topic is sedative and hypnotics. So myself, I am a resident assistant professor, Department of Pharmacology, Station More College of Pharmacy. So what is sedatives? The sedatives are the drugs to produce the excitement and produce the calmness of the patient. So what is the hypnotics? The hypnotics are the drugs to produce the sleep resembling natural sleeps. So what is the difference between sedative and hypnotics? The sedative drugs to produce the calm and cool the patient, and hypnotics to produce the sleep for the patient. So what are the classification of sedative and hypnotics? In that sedatives and hypnotics, they have a dose dependent. They act as a sedative action or the hypnotic action. So first category is barbiturates. In that barbiturates, we have it divided into three parts. The first is long acting barbiturates, drug example for the phenobarbital and mifebarbital. And short acting, in that short acting, the examples of the drug butobarbital and cigobarbital and pentobarbital. And third category is ultra short acting. In that ultra short acting, the drug example for thiopental and exobarbital. In that second category, the benzodiazepines. In that benzodiazepine, they have divided into three parts. The first one is long-acting benzodiazepines. A drug example for diazepam, flurazepam, clonazepam, and chlorothiazide. And then intermediate acting. In that intermediate acting, the drug example for alprazolam and estrazolam, and then lorazepam and nitrazepam. And third category is short acting. In that short acting, the drug example for triazolam and then oxazepam, then midazolam. Then third category is newer non-benzodiazepines. The drug example is zopiclone and the zopidem. And then some of the miscellaneous drugs act as a sedative and hypnotic action. The drug example first triclofos, and then chloral nitrates. So the mechanism of action of sedative and hypnotic, these are common mechanism of action of both barbiturates and benzodiazepines drugs. In that benzodiazepine sites, and there is a drugs to act as a benzodiazepine drugs in the benzodiazepine receptor, and barbiturates acts as a barbiturate sites of the receptor. In that GABA mediated benzodiazepine receptors, in that drugs, benzodiazepines or barbiturates can bind with the specific regulatory sites on the GABA receptor in the brain to produce the facilitated GABA action. And then the barbiturates increases the duration, and the benzodiazepine increase the frequency of opening of calcium channel. In that calcium channel opening, they have increased the influx of chloride ion, so that chloride ion, they have a enhancement of the chloride conduction. In that chloride conduction, the hyperpolarization of takes place in the cell membrane, so that our CNS system is depression. So, what are the pharmacological action involved in the benzodiazepines and barbiturates? First one is a barbiturates. In the CNS, they have a produced in a mild degrees of segregation to the general anesthesia action, as well as that anti-convulsion effect, depression of the respiratory center. And then CVS, in that CVS system, they have a produced in a hypotension, degrees of heart rate, and the circulatory collapse. Liver, in that liver, the enzymes has to be inducted, so that the increase of metabolism of itself, and other drugs to stimulate the glucuronidase transferase enzymes. Then fourth is kidney. In that kidney, the barbiturates can produce the antidiuretic effects to increase the ADH hormone, antidiuretic hormone, that decrease the urinary output by the decreasing of glomerular filtration rate. And then the eye, and in eye, there is a no effect, the normal dose. In that toxic dose, they have producing a meiosis effect. Then GAT, the barbiturates can produce the constipation on the prolonged use. Then what are the pharmacokinetic parameters? All the barbiturates are the weak acids and lipid soluble and absorbed orally to distribute throughout the body and redistribute the body from the brain to the skeletal muscles and the adipose tissue. The metabolized in the liver to activate the inactive metabolites ex- excreted in the urine. What are the therapeutic actions produced in the barbiturate. It is mainly used for hypnotic drugs and then sedative and general anesthesia and then anti-epileptic drugs and the potentiation of anesthesia and neonatal joints. And what are the adverse effects? There are so many adverse effects are produced in there. The first one is very common adverse effect is headache, drowsiness, and then dizziness, vertigo, and the cognitive impairments. So, what are the drug interaction? In that, benzodiazepines has show the synergism with the alcohol, and then other CNS depressants leading to the excessive impairments. And similitude and isoniazid acid delay the mechanism of metabolism of benzodiazepine. So in this video, we have to do overall bit what is sedative and hypnotics and what are the classification of drugs involved in that sedative and hypnotics process. In that classification, we divided into four categories. So first one is um, benzodiazepines and barbiturates categories and non-benzodiazepine drugs and then newer 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 miscellaneous drugs. Then that we are focused on the mechanism of action, the mainly common mechanism of GABA mediated benzodiazepine receptor and barbiturates. In that mediated receptors, the drugs to bind with the specific sites of the barbiturates or benzodiazepine receptor. Then they activate the chloride channel. So the enhancement of inducement of chloride ions to produce the depression of the CNS. Then what are the pharmacological effects to produce the barbiturates and benzodiazepine? And then what are the therapeutic uses of the benzodiazepine? Okay, thank you.